today's video, we're gonna be covering postpartum back pain. If you are a new mom or you've been a mom for many, many years and you have chronic back pain, I wanna give you a fun and easy workout that you can do right now. It's going to help strengthen, stabilize, and tone all the areas that you need most to relieve that pain. Now, there's a lot of reasons why you could be dealing with a lot of postpartum chronic back pain. The main topic that I want to talk to today is really around this idea of instability. As you're growing a child, your body produces this hormone called relaxin, and basically what this does is allows your muscles, your joints, your ligaments to relax, to let go, to loosen. What happens in the end of this process of growing a child is your joints, your ligaments, these areas in your hip and your low back become, in my opinion, unstable. Now that we're post-baby, what we want to do is focus on creating or recreating that stability, creating stability in the hip, in the low back, so that we can reverse what your body has naturally done. A really common and good place to start when it comes to postpartum back pain are Kegels. There's a lot to talk about when it comes to pelvic floor health. The way I teach it is really about deep core locking. Just becoming familiar with how to operate it, how to use it, what it feels like to be strengthening it. The way I use it in my coaching program is kind of starting and stopping your P stream. That's essentially what you're doing when it comes to Kegels. Start there. If you want to go deeper into Kegels and pelvic floor health, by all means, go beyond this video and research that and kind of dive deeper into the world of pelvic floor health. Moving on from pelvic floor health, we're gonna get into deep core activation. One thing that I like to do when I'm kind of transitioning from focusing so much on the pelvic floor, breathing, contracting, operating with some Kegels, things like that, is learning how to activate and contract the deep core muscles. One way that I like to instruct how to do this is by using your breath and also using a kind of a technique of pulling your belly button back towards your spine. Take a few deep breaths into their stomach, like fully go limp, really relaxed, force the air in an unnatural breathing way, deep into that pelvic floor. Then what I want you to do is I want you to exhale your breath. As you're exhaling, I want you to draw as if so you've already contracted, quick breath out, you've contracted. Now I'm exhaling and I'm pulling almost as if I have a string attached to my belly button, pulling that string back towards my spine without sucking in. I'm not vacuuming. So and I'm exhaling as much air as I can. While I'm doing that, I'm pulling that belly button back without actually moving anything in my stomach. This takes practice. That hollowing, that sucking in strategy is not good. That's not what we're trying to do. We're trying to really get connected with that deep core, and this is a great way to do it. Real quick, before we move on to the next exercise, if you're liking what you're seeing here and you want more, you want maybe even a workout that you can follow day by day that goes along with the exercise that you're learning today, put together a free 14-day core strength challenge series of workouts that you can follow for the next 14 days. I've actually added some strategic activities before the workout and after the workout that are really focused on bringing relief to the low back. It's absolutely free, fitnessforbackpain.com/core challenge. Second core exercise you'll be doing in this routine are overhead dead bug locks. Now, how you do this is essentially you're gonna grab a kettlebell and you can do these things with whatever weight is challenging for you. What we're trying to do is learn how to bring our ribs down, not just flatten our back and tilt our butt under, but find a neutral to you, what feels good. Don't try to alter the curve of your spine just to exercise. Find what feels neutral to you, brace around that, keep your ribs down. What's gonna challenge this idea is your ability to keep that position with this weight going overhead. So as this weight comes overhead, you're gonna wanna flare your ribs and kind of catch that weight from falling. We're gonna keep that rib flare from happening, bring it over our head here, lock that in, and we're gonna do the dead bugs. We're gonna have one leg come out and back. Now, if you wanna go further or you're able to go further, grabbing the kettlebell a little bit differently is probably gonna be the best bet for you. Hold it so you can really bring it above your head, and I'll demo this here in a second. So feet up, locking my good neutral position for my low back, Ribs are down. I'm gonna let this kettlebell come over my head. I'm gonna lock that in. And as soon as I start to feel myself kind of start to shake or lose control, you wanna maintain stability in that low back. As soon as that starts to fall apart, you gotta stop. All right, next exercise is the side plank hip lifts. Love this exercise. I'll use a light to medium resistance band or like a booty band, whatever you might have at the house, to kind of give some resistance to the glutes so we can activate those, which are gonna help stabilize the hip, which is what we were looking for. So how we're gonna do this, I'm just gonna do a knee or on my knees type of plank, just to keep it simple. I'm gonna stack my feet right on top of each other. I want the bottoms of my shoes to be in line with my back. So if you saw from this, my feet aren't way back behind here, they're actually in line. From here, I'm gonna stack myself in a nice, comfortable, neutral position. I'm going to move up. As I'm moving up into this side plank position, I'm actually going to pivot on that stacked foot. So pivot like this, and I'm going to combine the side plank lift here with the glute contraction. So I'm gonna come back, and I'm not just dropping and plopping down and bending my spine. What I wanna do is stay neutral, and I'm just almost kind of creating like a pumping action. So I'm here, I'm gonna sit back like I'm sitting in a chair, come forward, squeeze that glute, sit back like I'm sitting in a chair, come forward. I'm just gonna repeat this. I'm gonna keep my spine nice and neutral, and you're gonna feel it both here, because you're maintaining that plank. You're coming back, loading your hips, so it feels really good. And then you're squeezing at the top, activating this hip and this hip at the same time. It's a beautiful thing. Do them, and you'll love them. Last exercise in this workout series is a hip flexor strengthening exercise. Very underrated thing to do in general is strengthen the front of the hip. We always think about the glutes, the butt, the low back, the legs, but we don't really focus on the front. So we're gonna create balance. We're gonna create an even structure, an even stability around the spine to help you out. All right, what we're gonna do is we're going to attach a light band to something like a wall. Now, if you have different types of bands, essentially you're creating a march type of thing. When you come here and you bring that leg past 90 degrees, you're working your hip flexor. So what we wanna do is attach some kind of resistance to this foot so that when I come here, I'm getting that resistance that I want. Now you can do this standing, you can do it on your back, you can do it a few different ways, so be creative. I'm gonna show you on your back. So what I'm gonna take this band, I'm gonna wrap it around my foot, whichever way works best for me, and I'm gonna add a little secret trick to this that I want you to do as well. I'm gonna add some extra stability, especially if you have a chronic low back situation. Instability is usually what's causing some of your pain. So I'm gonna create some extra stability just to protect our low back. What I'm gonna do, ribs down, we've been working on that. Back is not pushed flat into the ground, but it's really just finding a neutral place. I'm going to brace, quick breath out. And essentially what I'm doing is I'm gonna have my left leg, or whichever leg you're not working, slightly bent here. And what I'm gonna do is I'm gonna pull this foot towards my head. And once I get a little bit past 90, I'm going to contract this left glute, so the opposite leg, by driving my heel into the ground and lifting maybe a ½ inch, very small amount of lift. I just wanna engage both, or I wanna engage that left side. I'm gonna pull, 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 and then relax, let it go. Come here, I'm keeping neutral here. I'm gonna pull and I'm gonna lift, pull, 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 squeeze, and I'm gonna relax. Making sure that you do both sides evenly, okay? If adding this little extra squeeze in the left glute or the opposite glute causes some sensitivity, just stop. Just stick to just bringing this leg forward and strengthening that hip flexors. And those are my favorite core exercises specifically geared towards postpartum chronic back pain. If you want to take this a little bit further, you want to kind of expand on what you've learned today, use these exercises and more in a structured kind of workout fashion, take my 14-day core strength challenge. It's absolutely free. I have workouts pre-created for you with relief strategies baked into the front and the back end of the actual core workout to focus on getting you the maximum amount of relief possible. fitnessforbackpain.com/core challenge.